The CDC is announcing that people who have COVID-19 but don't show any symptoms, they can isolate for a much shorter period of time. The agency's director says this will help people safely get on with their daily lives. But some healthcare workers warn the new guidance is a mistake. Paula Suro spoke to one nurse about her concerns for Georgia's hospitals.
It's very important that our number one priority is safety, especially for essential workers, vulnerable workers that have really been the backbone of this country throughout this whole pandemic.
Dr. Roxana Chicas has seen that vulnerability firsthand as a nurse dedicated to helping farm workers in the state. She says the CDC's decision to cut the isolation guidance in half for anyone who tests positive will also make healthcare workers more vulnerable.
In addition to the burnout where they are being slammed with all of these new COVID cases, such a high rate of people who are unvaccinated, I think really will put a larger strain on the nursing workforce.
The 5-day isolation period for asymptomatic people applies to both vaccinated and unvaccinated people per the CDC.
That concerns me because we already see vaccine hesitancy. That may be something that people will say, well, you know, what's the point of getting a vaccine if it's still going to be the same for both vaccinated and unvaccinated?
It feels very inconsistent and things keep changing.
Mother of 3, Sheila Meyer, who's unvaccinated, just recovered from COVID-19. She says the many changes are hard to keep up with, but the CDC says as new variants develop and science changes, so does its guidance.
It will be better for the kids that they don't have to quarantine, as long. That might be better, but it is confusing and it's hard to keep up with.
That confusion is something Dr. Chicas also worries about. She says all these adjustments take time and a lot of explaining for people to fully understand them. We have a full breakdown for you right now on 11alive.com.